For several decades, I have played competitive tennis on the cement courts in Southern California. In hindsight, being slightly bow-legged exaggerated the pressure and forces on my knees, so it's not totally surprising that I developed knee arthritis and significant knee pain. I'm a pharmaceutical chemist. For those who don't know me, I also have a master's degree in clinical nutrition. Unfortunately, the pain developed close to 30 years ago before I became an expert on plant chemistry and its potential benefits. Subsequently, because of this expertise, I became the principal investigator of several studies funded by the National Institutes of Health exploring the benefits of natural compounds for the prevention of Alzheimer's disease. I mention this to you so that you understand I am a scientist, not just some marketing or advertising person at a dietary supplement company. Because the pain occurred before my plant chemistry training, I agreed to do bilateral knee surgery, which was unsuccessful and made my pain worse. If you suffer from knee pain, I don't have to tell you how negatively it affects your quality of life. Walking up and down stairs is not only a real challenge, but potentially dangerous due to the instability the pain causes. Standing up from a chair or doing a deep knee bend to pick something off the floor or your grandchild can be difficult and painful. Having the training and the ability to assess and analyze medical studies and wanting to avoid drugs, I experimented on myself with those dietary supplements and herbal extracts that had some clinical documentation to potentially reduce my knee pain. I tried glucosamine sulfate and chondroitin sulfate at the proper doses and for the proper amount of time, but found little or no benefit. Again, this was not particularly surprising because several randomized placebo-controlled studies also found no benefit for some of these ingredients while some others did. It's important to note that many supplements you read about sound good, but don't have quality human studies supporting their use. Inflammation is a significant component of osteoarthritis that causes the pain we experience. Inflammation is actually a component of every chronic degenerative disease that we may develop as we age. So controlling it is crucial to reducing the pain of arthritis and also decreasing the risk of developing age-related chronic degenerative diseases. I understand what happens physiologically and chemically in the body, allowing inflammatory compounds called cytokines to develop, take hold, damage tissue, and cause pain. There are literally dozens of plant phytochemicals that have some degree of anti-inflammatory mechanisms. The goal of my research was relatively simple. I had to determine which of these phytochemical compounds were the most effective at reducing inflammation and pain. If I found a particular phytochemical compound to be superior, the fact that it might cost more had absolutely no impact on my decision to use it when formulating dietary supplements. Often in the dietary supplement industry, certain compounds are either substituted or used at reduced non-therapeutic doses by companies trying to save money. Making these kinds of decisions is foreign to my nature, my ethics, and my training. After several years of experimenting with the various anti-inflammatory phytochemicals, I believe I determined which of them was most effective. I discovered a formulation that reduced my knee issues by somewhere between 70 to 90%, depending upon day-to-day fluctuations. This combination also improved the health of my ligaments, cartilage, and dramatically improved my activity and mobility levels that I now enjoy. Click here for the best natural herbs and minerals for joint comfort and mobility. If knee pain or joint pain is an issue in your life, I strongly suggest you also read the free white paper I created for the thousands of physicians and nurse practitioners and other healthcare professionals who use or recommend my formulations. The white paper describes pharmacological and non-pharmacological interventions and discusses the data and pros and cons of each, and will be of significant benefit to helping you understand how to make the best decision. Here's to the best of your health, Curt Hendrix.